Welcome to our podcast, Poop Scoop Monday, where we go a deep dive every Monday into a topic you guys want us to talk about. And thank you for joining us today. We have a great show today. We're going to talk about fatty liver disease. We're going to do a deep dive on everything you need to know when it comes to fatty liver disease. A lot of people have asked us kind of what is going on. I have questions, I have concerns, so I answer any single question and every single question you guys have asked about us when it comes to fatty liver disease. If you're joining for the first time, my name is Dr. Islam. I'm a board-certified gastroenterologist trained at the Mayo Clinic. Our practice at Lubbock GI, we take care of all sorts of GI and liver issues. We've been doing this for over 10 years. We treated thousands of patients with liver conditions, GI conditions, and we've got them better as well. If you're new to this channel, don't forget to subscribe, like, share, and subscribe. If you're new to this podcast, give us our 5-star rating. And also, too, you may have noticed we also do this on the live stream as well. So if you're watching live, let me know if you're watching this live or on the replay, and also where you guys are watching this at as well. We're trying to get as much audience as we can. And if you have questions you want me to answer, don't forget to put them in the comments down below so we can talk and do a deep dive on some of those questions you guys have as well. So I'm excited. Football season's here and my Longhorns are doing great. Yes, I'm a diehard Longhorn. Let me know in the comments down below. If you're a big Texas fan, put a big T down below so I can see who my Texas fans are down below on the comments as well. Also, NFL is going on. Great first week of football. I love the fact that my Texas teams won. So big football fan. Let me know in the comments down below what is your team, both for college and the NFL as well. So in today's deep dive, we'll talk about fatty liver disease. We'll discuss exactly what is fatty liver disease. We'll discuss how do you improve fatty liver disease. We'll discuss the foods you should avoid when it comes to fat in the liver. We'll discuss how do we diagnose individuals with fat in the liver. We'll discuss the new medications. There's one medication that just got FDA approved for fatty liver disease, and we'll talk about any questions you guys have as well. We'll also talk about topics concerning itchy bottom. If you have an itchy bottom, we'll discuss in more detail about things that you can do to get that taken care of. Any questions you guys have on the live stream as well. So what exactly is fatty liver disease? Let me know in the comments down below if you or somebody that's been diagnosed with fatty liver disease. So what fatty liver disease basically is, it's fat that accumulates in the liver. Now, there are a lot of different reasons why fat can accumulate. The two most common reasons that we know about is called alcoholic fatty liver disease or non-alcoholic fatty liver disease. As you can tell by the name, alcohol is also a reason why you can develop fatty liver disease. And we have to kind of differentiate between which one is alcohol and which one is non-alcoholic fatty liver disease. Did you know that over 10% of the U.S. population has a diagnosis of non-alcoholic fatty liver disease? And it's very common. And right now, unfortunately, it is literally the most common cause of liver failure in the United States. It's the most common cause of liver transplantations, for your liver to go to cirrhosis, and it causes damage in the liver as well. And the issue when it comes to fatty liver disease, non-alcoholic, is that it is such a silent disease and a deadly disease that people don't realize that they have this condition until it's either too late or unless a clinician actually physically is looking to see if you have this or not. Now, when it comes to fatty liver disease, like I mentioned before, there's two main types, and we use the distinction of how much alcohol that you drink. And so alcohol content and how much you drink and how often you drink will determine which one that you are. Now, all of us occasionally may drink the occasional alcohol on the weekends, and that is not going to be classified as alcoholic fatty liver disease. Whereas if you don't drink any alcohol, or drink minimal amounts, that is going to be classified as non-alcoholic fatty liver disease. And that's what I want to talk about today, is the non-alcoholic one. So what exactly causes non-alcoholic fatty liver disease or fatty liver disease? Well, I think you kind of know that. It is things that we know can cause fat that accumulates in the liver. So obesity, foods, being sedentary, having a family history of liver disease as well, especially fatty liver disease, having a history of diabetes, high blood pressure. So if you overall are unhealthy, that unhealthiness will also affect what's going on in the liver as well, to cause fat to accumulate and to cause inflammation to occur whenever people do have that particular condition. Now, the issue when it comes to fatty liver disease is that it does not cause any symptoms. This is why it's so scary, because once you've been diagnosed with fatty liver disease, excuse me, you don't know that you have it unless someone's actually looking for this condition to see if you have this or not. It's typically asymptomatic. So you may be having it right now, and you may not be realizing that your liver is becoming more damaged, more inflamed, and more irritation as well. So how do we diagnose somebody with this? Well, the first thing we have to do is that we have to have a high clinical suspicion. I have to think that you have this. So how do I think that you may have this? Well, if you have certain conditions, this will allow me to determine, I think you have this condition. So for example, if you're coming to see me, you already are obese, well, that automatically makes me think you may have fatty liver disease. But if you also have diabetes, or you have high blood pressure, or you have heart disease or strokes, all of this in combination would absolutely make me think that you have that. Now, because it's asymptomatic, we have to be looking for it. And so because of that, we have to determine, are you the person, or do you have the characteristics or the medical conditions that can also lead to fatty liver disease? And if you have those conditions, absolutely, we'll check you for that. So how do we diagnose this? So once we have the clinical suspicion, we'll do a couple different things. One thing is that we'll do blood testing. So we want to check all sorts of other reasons why your liver may be fat, whether it's autoimmune diseases, there may be some genetic abnormalities, or other viruses. We want to make sure there's no other reason why your liver is inflamed. We'll check your liver numbers as well, see if they're high or low, and we'll do imaging of your liver as well. Now, there's a couple different imaging tests that we can do to see exactly what is going on. What's important for me when it comes to imaging is not that you have fat, because I already know that based on how you look, your medical condition, but anything else going on. When we do an ultrasound allows us to see exactly how the liver looks. So we can see if there's any masses that are growing, if the contour of the liver is looking okay, is it cirrhotic looking, which is end-stage liver failure, or does it look just like a lot of fat? But what's important for me is not that you have fat, but is that fat actually causing damage or what's called fibrosis? Because it's fibrosis that predicts how your liver is going to do. If you have fibrosis, that means we are getting to a point in time where you actually may develop liver failure or cirrhosis, and we need to make sure that we can do what we can to prevent that from that getting worse. So the combination of imaging tests and blood testing is going to give us a global picture of how your liver is. Now, unfortunately, imaging and blood testing are not the gold standard for what we can do to diagnose how fat your liver is and what stage it's at. This is a great non-invasive way for us to do this. And this is what we try to aim for in medicine, our non-invasive testing. Because not everyone wants to get an invasive testing. In fact, the vast majority of people shouldn't. But the unfortunate thing about non-invasive testing is that it doesn't give us the most accurate diagnosis. And so the most accurate way for us to diagnose somebody with fatty liver disease is to do a liver biopsy. This is where we actually take a sample of your liver. We look at it under a microscope to see what exactly is going on. And we use liver biopsies for a lot of different reasons. We use it to assess the degree of fatty liver disease, to see if there's fibrosis or not, or scarring. We also use this in other liver conditions as well to see exactly what is going on. Because sometimes we don't know. You'd be surprised, but often in the medical space, we're not quite sure what is going on. And so a liver biopsy can also allow us to determine other things that could be causing inflammation in your liver. Things like autoimmune disease or genetic abnormalities or even viruses. But we try to avoid invasive testing because it's not fun. For you to get a needle poked in your liver and get some samples out, that's not fun, which is why we try to aim for non-invasive testing. Now, the biggest thing that you have to realize is that you have to have a high clinical suspicion of this. So if you are obese, if you are overweight, if you're sedentary, if you have diabetes, if you have heart disease, if you have strokes, if you have high cholesterol, you are at risk for developing fatty liver disease. And if a healthcare provider is not checking your liver, you be proactive and get it checked. Ask for an ultrasound, ask for blood testing, ask for scans to see how much scarring is in your liver, like a fiber scan or an elastography. These are tests that we order and that I order as a liver specialist to allow me to determine exactly what is going on with your liver. All right, so let's say I've done my testing. I got my diagnosis. I say you have fatty liver disease. what do I do to recommend for treatment? Now, there are a couple different ways that we can treat patients. Number one is that we try to minimize the foods that we know that can cause inflammation to occur. Now, these foods are foods that are high in fat, high in red meat, and high in bad carbohydrates. And it's the foods we want to try and avoid. Now, I try to make things as simple as I can for my patients because it's hard to get dietary advice. So here's what I tell my patients as a liver specialist. So we live in Texas, so I'm going to tailor this to the South. So we want to try to minimize our tortillas, minimize our fajitas, minimize our rice, minimize our potatoes, our fries, our pizzas, the carbohydrates that we know that we like, but we also know that can cause inflammation to occur. Now, I don't say eliminate it. I say try to minimize it because it's hard to tell somebody to eliminate a food that's part of their culture. I don't want you to do that. Number two, I tell my patients as much as you can, add in as much fruits and vegetables in your diet because this will help to change the inflammation going on in your liver. Those fruits and vegetables actually have antioxidants, and these antioxidants can change the microbiome of your liver to make it normalize and to actually reverse the damage that's there. Number three, I do recommend black coffee. There are studies to suggest that black coffee alone can change the course of your liver. Now, it's 2 to 4 cups of black coffee per day, not with all the cream, not the sugar, not the yummy stuff, but studies have shown that black coffee alone can change the course of your liver. What about supplements? Now, I have to be very careful with supplements because a lot of the supplements that people take actually damage your liver as well. So if you see a supplement, always make sure you speak to your healthcare provider about this. There's some evidence that milk thistle can help out. For some individuals, I would recommend this. Once again, speak to your doctor before you do this. There is some evidence for vitamin E in certain individuals, but once again, not everyone. So always make sure you speak to your doctor about this. I never, ever, 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 ever recommend any type of liver detox medication, because these liver detox medications don't detoxify your liver. They actually make it worse. They have ingredients in them that can destroy your liver. They've done studies to suggest that they have done studies in which they took these medications and they actually cut them up and looked at them under the microscope. And they compared what was in the pill to what was in the ingredients. And guess what? They were completely different. What was on the ingredient bottle was very different than actually what was in the pill. And in fact, what was in the pill actually ended up being more dangerous for your liver and for your body. And so do not take any type of liver supplement unless it's specified by your doctor, and just make sure it is something that is recommended for that. We do know that diet plays a role. Number two, I always tell my patients to stop alcohol. Once you've had fatty liver disease and once you have inflammation from that plus a combination of alcohol will almost triple your risk for developing liver disease and liver cirrhosis. So I know it's sad, but I don't want you to be dying from liver failure by having a good time by drinking alcohol. So if you're drinking alcohol, you need to stop. And I wish I can tell you otherwise, but you just need to. Number three, I try to tell my patients to be on more of a Mediterranean type diet, which I mentioned before. Lots of fruits, lots of vegetables, lots of healthy fish, lots of healthy poultry, lots of nuts. These things are actually beneficial for you and can help out. And then also make sure you exercise. I cannot emphasize the importance of exercise. So even going for a brisk walk every single day, even if you don't lose weight, the physical act of exercising will dramatically reverse your liver to make it normal. You don't even have to lose weight to get the benefits. And that's what's remarkable about your liver, is that the physical act of moving about will make things better for you, can change your liver, and can reverse the course of how your liver is. Because my goal is to reverse your liver to normal again. And we have the capacity to do that. But once you've crossed that bridge to scarring and fibrosis, we cannot go back. And so what we try and do is we try to make it go back all the way where we can reverse exactly what is going on in your liver. And we want to make sure that we can get this taken care of for you as well. So we do have an FDA approved medication for fatty liver disease. It's called Rezdiffra. And this just came out in the past couple of months. And this is indicated for those individuals that have F2 or F3 fibrosis, which is kind of a medical term that we use to determine how much scarring that's there. Now, if you've been diagnosed with fatty liver disease and there's evidence of scarring, and we have evidence of scarring both from imaging and blood testing, Talk to your doctor about being on this medication because the studies have suggested this can help reverse the damage that's in your liver, to normalize your liver, to reverse the fibrosis and the scarring that's there. And that's our goal, is that we want to try and find ways to reverse the damage that's been found in the liver and to make sure it does not get back. But also, even if we can't reverse it, we also want to make sure we don't make it progress to something worse like cirrhosis. And so for my patients who have a diagnosis of fatty liver disease, who have evidence of fibrosis on 2 different tests, absolutely I will recommend this medication. It works great. It has very minimal side effects and actually can help out when it comes to making your liver normalized again and to get that taken care of for you as well, and hopefully get things all squared away for you. It works great. It's a very effective option that I recommend for my patients who have fatty liver disease. And for those individuals that have that, it has been a great option to give them an opportunity, in addition to lifestyle changes, which you cannot avoid, to reverse the damage that's going on in your liver. All right, perfect. So let's go through a couple of high yield questions I got from patients. So number 1, Dr. Islam, what is the difference? Number 1, is fatty liver disease actually common? And yes, it is. 10 to 50% of the people in the US have this condition, but more importantly, it is now the number 1 reason for liver failure, liver cirrhosis. So out of all the people out there that are dying from liver disease, the most common reason is that they actually have fat in the liver from fatty liver disease, and that's why they're developing liver cirrhosis. So we need to find ways to reverse that, change that, and make sure this never is not a problem again. Next question. Hey, Dr. Islam, can fatty liver disease affect other organs? And yes, it can. So keep in mind, fatty liver disease is a symptom of a problem, which is fat all over. And if you've had fatty liver disease, there's an excellent chance you have fat in other areas of your body, like your pancreas. We have evidence that you can get pancreas issues when you have fat. It puts you at high risk of developing colon polyps, colon cancer, heartburn, esophageal cancer, heart disease, stroke, neurological problems. The list goes on and on and on. So it's not that fatty liver disease itself causes these problems, but fatty liver disease is a consequence of another global condition, which is just being overweight, which in turn is not good for your overall health. And so this is kind of my approach when it comes to treating my patients who have fatty liver disease based on 10 years of treating all sorts of patients with this. All right, perfect. Let's talk about some of the questions that we have here. So there's a question on here about using collagen peptides for fatty liver disease. And I'll tell you right now, we actually do not have any evidence that using collagen peptides can help out when it comes to fatty liver disease. We do have a regimen that I recommend my patients: black coffee, diet, exercise, adding some supplements. This does work, and we've seen a change in the fibrosis of that. But also, too, we also have new FDA medications that were not available before when it comes to fatty liver disease. Great question. Perfect. So the medication for fatty liver disease, once again, I always have to, let me just spell it out for you guys, because I always have to, Rezdiffra, Rezdiffra. It's one of the ones that are currently approved. It's the only one that's approved when it comes to fatty liver disease. And we've used it in our clinic, and it's actually worked very, very well for a lot of our patients when it comes to their conditions, when it comes to fatty liver disease as well. All right, perfect. So we'll go into other topics you guys have asked about. Our first topic we're going to talk about today on today's, the next topic is going to be, now I'm going to give you 11 reasons why your bottom is itching. And at the end, I'm going to give you 3 tips that I recommend to get that itchy bottom taken care of and to get you feeling better and to resolve those issues as well. So number one reason is that actually may be due to a hygiene issue, meaning you may be too clean down below. Yes, that sounds kind of crazy, but actually having a bottom that is too clean can predispose you to develop infections, irritations, and itching as well. And so what I tell my patients is that you want your bottom to be clean. Absolutely. But you don't want it to be sparkling clean, and you don't want it to be all shiny and, like Mr. Clean like, but you want to have enough cleanliness. But too many of us sometimes go the extra mile because we're overachievers to make it super clean. So here's what I'm going to recommend for this one. So number one, don't wipe too much because that's going to make it more irritating. Number two, when you do wipe, if you do choose to wipe, use unscented toilet paper. Number three, avoid washing with soap, especially scented soaps. I know you guys, when you're in the shower and you're lathering up, I know where that's going. So try to avoid that. But I'm a big fan of using a bidet. Bidets are fantastic. They'll keep you clean. But not only that, how about when it comes to irritating the bottom as well? Number two is that you could actually have a skin condition called psoriasis. So psoriasis is a very common skin condition that can cause itchiness, plaques, and silver flakes kind of all over your body, including your bottom as well. Now, the way we can diagnose is that we can do a rectal exam and kind of see that's there, but the best way to do this, fortunately, is to see a dermatologist who actually can diagnose you with this. Number three is that you could actually have eczema in the bottom. Yes, so you know how you have eczema on your skin where you're itching all the time? Well, you could have it localized to the bottom. This is also called contact dermatitis. And this can be due to any number of different reasons: the type of detergent that you use, the type of underwear that you use, the type of clothing that you're wearing, scented areas as well. These things can cause a contact dermatitis to occur, and that can cause itching to occur as well. And so don't be surprised if this may be another reason why you're having some itching down below. And so kind of be careful of that. You can also have another skin condition called lichen sclerosis, which is also another autoimmune disease condition in which you have kind of a whitening, flaking area of your bottom. Once again, this can be diagnosed with a rectal exam, but also with a dermatologist's help as well. Next, it can be the type of clothing that you're wearing. If you wear tight clothing, that's going to make it more likely for you to develop some sort of infection, some moistness in that area, and some irritation as well. And that can also cause you to have a lot of rectal itching as well. And so if you are those individuals that wear tight clothing, obviously the easiest thing will be to not wear clothing that's tight. Or if you decide to go and do that, just make sure that you have clothing that's 100% cotton, because that's going to be the best way for us to minimize or mitigate the itching that can occur whenever you have too tight clothing. Next is that certain foods can irritate the bottom. These are the 7 foods that I know that for my patients can irritate the bottom. If you're having rectal itching, try to avoid these particular foods. Number one is coffee. So coffee, caffeine, tea, these types of foods are known to cause irritation of the bottom, especially if you have hemorrhoids or itching, because that will stimulate the whole colon to move things through, and that can also stimulate the rectum to be irritated as well. Number 2 are carbonated beverages, kind of the same concept. That carbonation, that gas, will cause irritation of your rectum to make it a lot more difficult to handle as well. Number 3 are citrus beverages or drinks. These citrus types of foods have a lot of spices in them, and that can also irritate your bottom to make it more likely for you to develop irritation down below. Next are energy drinks. Energy drinks have multiple different whammies. They're carbonated, they're caffeinated, and they also may be citrusy as well. And they're just not good for you. This will stimulate things all throughout the gut, especially your bottom as well, to make things worse. Next are nuts. Did you know that? Nuts, yes! Nuts can also cause irritation to occur, so try to minimize your nut intake so you don't cause irritation down below. Next are refined carbohydrates. These are carbohydrates that are not good for you. You shouldn't be eating them anyways. And if you have itching on top of that, it's going to make things worse, so try to minimize that. And then lastly, spicy or acidic foods that can also cause that to occur. A next reason why your bottom may be itching is that you could actually have a worm infection. Yes, pinworms. So pinworms are a very common cause of itching kind of all over the rectum area, but also around the genital area as well. And this typically occurs in school-age children. However, if you have kids, you know what type of stuff they're bringing from the daycare, the colds, the sicknesses, and sometimes even the worms as well. So sometimes in some individuals in the right setting, we'll check you for worms to see if that's the case. Then that may be a reason why you're having some irritation down below as well. And then also hemorrhoids and fissures, my expertise. We take care of itching, but we also take care of hemorrhoids. Hemorrhoids are dilated veins in the very bottom and cause pain, bleeding, itching, and pressure as well. And also fissures, which are tears in the rectum that can cause pain, can also predispose you to developing itching as well. So if you have hemorrhoids, you may not even realize it because the only symptom may be anal itching. Also, infections can cause itching as well. The most common infection in the bottom being candida. This is a white, kind of a plaque area in your bottom that very commonly can cause itching and irritation to occur. It's the exact same thing as what occurs with diaper rash as well. The exact same concept for that as well. And then also, lastly, unfortunately, cancer. Anal cancer can also present as anal itching. Let me tell you a story of a patient of mine. I had a patient that, 30s or so, late 40s, that was presenting as just rectal itching. And no one did a rectal exam. I did a rectal exam. There is a full-grown cancer that was there. And that was the reason why they had itching. The only presenting symptom was just rectal itching alone. So it's very rare, but yes, it can do that. It can cause those problems that are there. So let's say you're suffering from anal itching. What can you do today to get that taken care of? Well, number one, make sure you try to minimize those detergents and those soaps that can really are known to cause irritation to occur. Number two, use some sort of barrier to help ease that itchiness that's there. There's balneol cream and Desitin cream, zinc oxide. These things work really effectively as a barrier to make it easier for you to resolve the itching over the counter. And then lastly, get your hemorrhoids fixed. The first symptom of hemorrhoids could be just itching alone. So if you have that, get your hemorrhoids fixed. This will resolve these symptoms and get you taken care of. Listen, itching is a problem. It is for everyone. It is for you. And I know that you guys have issues with this. I've seen my stats on social media. So if you have a question about that, let me know in the comments down below or come see us at Gastro. We are itching experts to get you taken care of. All right, perfect. All right. See on here on TikTok. Any questions on TikTok? Let me go on here and say hi. All right, perfect. All right. Next topic we'll talk about are tips to keep your family healthy. So let me just tell you this. It was my birthday last week. Yay, happy birthday to me. I feel like an old man. But one of my goals whenever I, turned older is that I want to be healthier, but I also want my family to be healthier. Now, I'll tell you overall, we're pretty healthy. I'm pretty happy with the way that we're eating. But there are a couple things that I've found to be tips that I've realized that can help out. So I'm going to give you some of the tips that I recommend that I found to not only make you healthier, but also your family healthier as well. We are the product of the people who we hang out with, and our family are the individuals who we hang out with the most. And so we can make them healthier, it'll make us healthier, and vice versa as well. So number one, don't go gung-ho on people's diets overnight. We use this in medicine, same advice I give to your families. We all want to be healthy, but we cannot change everything in our diet overnight. It's impossible. But not only that, it brings frustration to you, to them. It makes everyone just feel bad. They think, oh my gosh, who's this person who's trying to change me and tell me to do everything? Go low and go slow. And I tell this to my patients who are trying to lose weight as well. Make one small little change and do that for a while. One small change is much better than no change. And going slowly, but doing it over time, is much more beneficial for you than trying to make a huge change all at once. So go low, go slow, and make small little changes. That'll make a difference for you. Don't put a big burden on you and the family. Start with something small. Maybe pick one meal that you can eat in a healthy way before anything else. Maybe added more water every single day. That's fine. Maybe give up one can of soda. That's great. Go low, go slow. This will help out. Number two, I hate restrictive diets because I don't want to restrict anything. I like adding more variety. So instead of restricting your diet, add more variety. And the best way you can add more variety is to add more plants and vegetables. The world is full of millions, trillions, gazillions of plants and vegetables that are out there that can be made in so many different ways. And they are so freaking good. Expand your palate. Try different things. Try fermented foods. Try foods from Asia. Try foods from South America. Try foods from Canada. I don't know. But try to embrace your palate more to get you the types of foods that you want. Try spices. Try new herbs. Try things that will work out, because I will tell you, if you do this, you'll be surprised how good the foods are. I used to be a straight up meat guy. I ate meat all the time. That's how I grew up here in Odessa and West Texas. But I decided, about 10 or 15 years ago to radically change my diet. So I incorporated more plants, more vegetables, more spices. And I cannot tell you how much better my taste buds are. They're more pickier because I know exactly what good food tastes like. And it's a shame that a lot of us don't realize the variety of foods that are out there. So try to expand your palate. Number 3, schedule in fun food. It's okay to have fun. I have days and I have meals when I will schedule in foods that are good, for fun. That's okay. One meal is not going to make a difference for you. I can guarantee you it's not. Now, okay, maybe the exception is if you eat like 1 billion calories for that one meal, okay? But on Saturday night, I enjoy my time with my family. I enjoy my time with my kids. I will have dessert. Oh my goodness. But yes, I will, because I want to have that fun. I want to enjoy my life. I want to spend my time with the family. And if you do that, it's going to make you feel good as well. Next, you'd be surprised, but address how your food is on your refrigerator. For a lot of us, the fruits and vegetables and the things are on the very bottom. They're in like shelves. You can't see them. And all the other foods are in front of you. Reverse that order. Put your fruits and your vegetables in your refrigerator at eye level where you can see them all the time. This is a small hack that I learned that really helped me out to really pick out those foods that I really wanted to eat. So do that, because it will help out as well. And put those other foods in the drawer instead. And then lastly, involve the whole family when it comes to meal prep time. Make it a fun event. We get our kids involved. I make them do it, but that's okay. My wife gets involved. We make it a fun event. We put on music. We put on TV. We watch it. We hang out together. Make this a family event. Use this as a time to bond, but also to eat better as well. These are things that I've used in my life to change the health of my family. I think if you incorporate these tips, you'll start to notice a change in your family as well. All right, guys, I think that's everybody. That's the show that we have for today. I want to thank you for watching. If you haven't already, if you like what you see, if you like what you hear, smash that like button, like, share, and subscribe. Give us a 5-star rating. Subscribe to our channel. Subscribe to our newsletter. And if you live here locally, love a gastro, come see us. We can take care of all your issues and hopefully get you feeling better. And thank you for watching. And I'll tune in next week to see you guys on our future podcast and our live stream. Hope you guys have a happy and healthy day.